The big change in our societies is the ageing of our population. So now people can expect to live to older ages. And that's a good medical research story because, again, it's about managing a number of chronic diseases or stopping them from occurring. So more and more people can expect to live into older ages. The downside of that is that the major risk factor for dementia is ageing.
The traditional killers of cancers and cardiovascular disease are in decline. The new diseases of the 21st century are neurological.
Now, there's a lot of neuroscience research that goes on around the world, and probably the biggest disease that everyone's focused on is Alzheimer's disease. So thousands of people working in labs and universities, biotech companies, pharmaceutical companies, trying to come up with new ways to intervene, and we haven't got anywhere.
We call Tassie sort of the innovation island. You know, we're in this highly innovative space. We have Mona. You know, people say to me, what's it like living in Hobart? And I say, Hobart's the New York of the South. And so we're in this creative space, you know, and that's part of why we can do what we're doing. Well, the Wicking Centre is a quite interesting beast. You know, the big problem with health is that there is really a lack of genuine, meaningful, constructive, interdisciplinary engagement. If you can't consider the issues facing an elderly person or indeed a person with dementia through a multidisciplinary lens, then they're not really going to get the best possible outcome.
Within neurosciences, we have our own journals, our own conferences. We all meet together at various times and share results, but sometimes seeing the practical benefits of all that neuroscience research isn't so obvious.
I've got to say that it wasn't me that said I wanted to engage with the neuroscientists. It was actually James, the neuroscientist, who said, I want to engage with the social scientists. And he sort of came to me and said, you know, we could work together because what I want to do is actually do something that will make a difference. In our respective fields, we compete in the markets where there's funding for our research. So there's no funding for, you know, research that combines neuroscience and social science. The funding isn't set up that way.
And so we had the opportunity to meet with the folk who were behind the Wicking Trust, and we essentially pitched an idea what might come out of people who work in a number of different disciplines deciding that they are going to work together, you know, for research ends, but also for practical and useful ends as well. The Wicking Trust funding basically gives us a lot of flexibility to innovate, and often actually with other more finite or definite grant sources, sometimes your flexibility to move isn't there. So I mean, one of the great things about the Wicking Trust funding is that we've got this ability to adapt quickly and to take you know, new initiatives forward and sort of seize opportunities.
We had taught a lot about care and done a lot of research on care, but we'd never actually got a really deep and insight into the neuroscience of dementia, you know, the pathology of dementia. And what working with James gave us was a really good understanding of that. And that was quite profound because at the time, people were talking about living with dementia. And we actually, from working with James, got the courage to say dementia is a terminal condition. That really then helped us to drive our social science agenda, which was to develop a palliative approach to the care of people with dementia.
So working with Andrew, I came to understand that actually it didn't really matter if you were a person with dementia, a family carer, a support worker, a nurse, a doctor, that it was usual that your knowledge of dementia wasn't that great. So in some ways, this was a lucky combination that we were in the game of developing educational programs within the School of Medicine, and we identified a real knowledge gap.
So if you've got a family member with dementia, you can expect between 60 and 70% of those people not to know that this person is dying. If they're in an aged care facility, you can expect to have half the staff not know that.
What the Wicking Trust funding enabled us to do was to be much more dynamic and innovative as well too. So it was about trying to determine how we could work a bit differently and how we can reach groups of people who needed knowledge around dementia.
And we were talking about ways that we could intervene on a large scale. Of course, James says, well, why don't we do a MOOC?
So this gave rise, on one hand, to our massive open online courses, or MOOCs, which were initially targeted at lifting people's understanding of dementia, and through to also a degree program, a diploma, associate and bachelor's degree in dementia care.
And we did that in partnership with an industry body, Aging Community Services Australia. And I think in our first cohort we had 190 students, and the industry partner recruited all the students. And the rest is history. Now I think this year we've got 1,500.
In 2010 we established the Tasmanian Healthy Brain Project. This was an ambitious project. It involved recruiting around 500 Tasmanians to look at this question of whether more education provides greater resilience or cognitive reserve so that you can resist dementia. What's really interesting though, these aren't young people. Normally we think about university for young people. These are people between the ages of 50 and 80 when they came into the program. A year or so later, we were able to get National Health and Medical Research Council funding for that project based on the preliminary data that we were able to generate due to Wicking Trust funding. And we've now had 2 cycles of funding from the National Health and Medical Research Council out to 2022. But it just wouldn't have been possible for us to have started that project without that support from the Wicking Trust.
So we need philanthropies to step up into that innovative space. The space where government have got their eyes somewhere else, the NHMRC have got their eyes somewhere else, but we have these very compelling projects that have to be done. Today there's probably 6, 8, 10 dementia MOOCs in the world. I doubt there'd be 1 dementia MOOC in the world. I don't think there would be the research that we're doing into prevention or mitigating risk factors. Dementia is a terminal condition and life-limiting is now mainstream. Alzheimer's Australia has changed the way all of their stuff do. We actually have changed the discourse. None of this would have happened without the Wicking funding.
And now we have one of the country's largest centres of dementia research and probably one of the world's largest centres of dementia education.
In the 21st century, with the strategies that are now available to us, it means we are now a global brand, and we probably and are arguably the leaders in driving better dementia literacy in the world.